They use a multidisciplinary approach to treating chronic pain, which includes the healing art of acupuncture. Joining me now is acupuncturist Cindy Cornell from the Pain Center of Arizona. And I think it's really interesting to talk to you because acupuncture has come such a long way. When my mom used to get it done when I was a little girl, they used the little bamboo things I saw them sticking in her. And you don't have to do that anymore.
No, you don't. You can use acupuncture needles and you can use non-needle acupuncture, which are the two types of therapies I use.
How did you get involved with the Pain Center of Arizona?
With the Pain Center of Arizona, I was looking for a pain center that I could do integrative pain medicine. As a nurse practitioner, I wanted to look at growing as doing more therapies, not just pain medication. So I searched for a clinic that I could grow as a clinician.
And that was video we were just saying of some of the work that can be done.
Correct. We can do acupuncture with needles and without needles. The one treatment that I do today is something called e-stim, or this little gadget that I use can be treated for multiple different types of treatments with acupuncture.
I like that it looks like a pen. It doesn't look like, for people who don't like needles, that looks like a ballpoint pen.
It does. It looks like a ballpoint pen, so you can use it for migraine headaches, fibromyalgia, multiple different types of pain disorders, something like failed back surgical syndrome, and it's easy to apply. So if I could demonstrate on you.
Oh, that's okay. I've got my hand right there.
So if I would go to treat you, let's say you had a headache. This is a classic acupuncture point. I touch your hand, I apply it on your skin, and it just feels like a little discomfort.
Oh.
So it's not as uncomfortable as needles or shots.
What's the greatest benefit from this type of acupuncture? Is it that you don't have the needles?
You don't have the needles, and you get pain relief much quicker.
Oh.
The other benefit is it causes a muscle relaxation. The relief is quicker. It can last you a lot longer. It increases your natural pain relievers called endorphins.
Do you have to go as many times or go as often if you get this type of acupuncture?
If you get this type of acupuncture, you may go for twice a week for a couple of weeks, and then it may last a lot longer than just needle acupuncture.
Tell us more about the Pain Channel, because that's where people can see interviews with other people who've gone through this.
Right. The Pain Channel will show you a lot of different types of treatments. It gives a lot of education for the patient. So if you want to learn more about the acupuncture, you can go to the Pain Channel and learn about acupuncture and different types of treatment for our patients.
For people who've tried this maybe the first time, what are they saying after they get it done?
The first response they do is once they get up off the exam table, they tell me that their muscles feel relaxed, they have a better range of motion, and their pain reduction is usually anywhere between 50 and 60% decrease.
Do you think acupuncture is more accepted by people now for pain relief?
It's more accepted today because a lot of patients do want pain relief quicker, and they want to get away from medication. Some want a combination, so that's why integrative medicine seems to be more of the trend today, because it can combine a combination of acupuncture, medication, and other treatments.
And people can see, like we saw video earlier, but they can see, other stories from people who maybe not had acupuncture, but other treatments from the Pain Center of Arizona.
Exactly. There's other stories on the TV channel that shows their success stories with the pain treatments.
So it's more than just acupuncture, it's other things as well. Thank you so much for sharing that. And I don't have a headache, so thank you very much.
You're welcome.
For more information on the Pain Center of Arizona and the Pain Channel, you can go to painchannel.tv or thepaincenter.com, or call the number you see right there on your screen.